There you go. So welcome everyone to this new community chat. Today is April 29, and we're happy to be talking today about basically how your donated dollars can help healthcare. And for that, we're having a very special guest. Is the director of the Montefiore Nyack Hospital Foundation. Her name is Tracy McLean, and I'm very happy to have you here, not just because she's an excellent professional, but it's a lot that we have in common, so we're good friends. So
Yeah.
yeah, so without further ado, just to let you know a little bit of how it works, we are recording the session to that later you're going to be able to see in our community YouTube channel. And also, because we're a smaller group, you can just ask your questions live. You can use the Q&A box. You can use the chat box if you're a little shy and prefer not to talk. Whatever works for you. But the good thing is that we can have a live conversation with an expert. So let's start. Tracy, tell us a little bit about you and the work you do. How did you get into fundraising and stuff?
Oh, wow. Well, thank you first, Sandra, for having me and inviting me onto the panel today. It's an honor and privilege to be here. As you know, I'm a professional fundraiser. I've been in the biz for probably close to 25 years. My experience spans from healthcare, social service work, mental health, and education. So I've been all over and back, and the world has led me to here, my local hospital. I am a native of Nyack, and I was born here in this hospital. Not saying how long ago, you're just gonna have to guess. But it is exciting to how life is full circle, and I'm doing what I love for a place that, that's really near and dear to my heart.
Excellent. No, well, you just said you have 25 years of experience, but you don't want us to guess your age. So I would just say that you started working when you were 5 years old, correct?
Basically.
Yeah, something like that.
Okay. I threw a mean bake sale back then.
Maybe you were very good at asking money at 5 years old, asking for money at 5 years old, right?
Right.
So how did you get into it? Because, for example,
Sure.
I have to say myself, I will not sell even the lottery winning ticket. Like, I will not be able to sell anything. I'm the worst at asking for money. Even when you do things like, okay, let's purchase a gift together for someone, I end up paying the whole thing because I will never be able to ask people for money. So how do you get into this? Like, how do you do it?
It's funny because I've always wanted to be a fundraiser as early as in junior high, in the 7th grade. I remember there was a big earthquake in California. And I was so devastated seeing this on the news with my family. And I turned to my parents and I'm like, I want to do something. I don't know what to do. And, my mother said, why don't you talk to your friends at school and see maybe you all can do a bake sale and donate monies. So I went in the next day. I talked to my friend Stephen Klein, who is also an amazing leader in this world. And we decided to do a karaoke party. And we went to the principal's office. We were able to do it in an evening on the weekend, and we charged everyone like $5 or whatever. I don't remember what it was, but we ended up raising $500 among 7th graders. And no one really did that in that time, especially the youngsters. So it was so inspiring. The principal made a big deal and had the Journal News come out and take a photo of us with the check that we donated to the American Red Cross. Dr. Kane, I remember him. And from there inspired my love for wanting to raise money. So it's funny because then I would go to my guidance counselor in high school and say, hey, Mr. Santoro, I want to be a fundraiser. He's like, I don't know how we can get you on the right track with that. And he's like, why don't you do communications? So I ended up getting my degree in communications, and my first job was at Calvary Hospital, helping to raise money and helping to manage media. So I had development and marketing on both sides. I was able to get into that, and that spurred my love for fundraising. So it's just really awesome how the power of a dollar can really make a difference in someone's life, no matter who you are, whether you're the most vulnerable or whether you're whoever you are in this world. It really does make a difference in the lives of others. And I'm blessed to be able to do that.
So you just mentioned communication. So did communications, like having a communications degree, help with the
Yeah, it did.
intentions?
It really did, because in fundraising, there is writing. There is quite a lot of writing, whether you're a grant writer or whether you're a storyteller, right? So writing about a specific story that happened, about a patient or a client or a victim, etc. You know, you do need excellent writing skills to be in this profession. And basically, you know, majoring in communications has definitely helped me and my skill set, and has brought me here to where I am today.
So I obviously we're gonna be talking about the Montefiore Nyack Foundation and all of that, but you know, I'm thrilled to learn more about you and just the job in general. So what has been your biggest fundraiser?
In terms of like my biggest accomplishment in terms of fundraising,
Yes.
if you're referring to the largest gift that I have secured, would be I secured a gift from a family foundation, a personal gift to the tune of $250,000. And people have to understand that the thing with fundraising and major gifts, it doesn't happen overnight. You know, when it comes to fundraising, it's about building relationships. We just don't come right out and ask you, you know, hey, Sandra, give me $100. You know, it doesn't work like that. We first have to lay down the groundwork. We have to get to know you, and we want to make you a part of the family. We want to know things about Sandra that, you know, and become friends. We want to get to know your family. We want to get to know your neighbors. We want to get to know, you know, everything about you, so that we can tie you closer back to the organization, so that when you do make a gift, your gift is more meaningful and impactful. You know, it's not just me asking you for money. It's more than that. It's a relationship, and it grows deeper and deeper as the years go on. So that gift that I secured, you know, that was over time. And that was something that the family, you know, we worked together to do. And it was easy as time went on. So just to give you a little history on that.
Yeah, so that's beautiful. You know, it's like it's about receiving, but it's also about giving, you know, like how good it feels to give. So tell us a
Yes.
little bit about the Montefiore Nyack Foundation.
Sure. So the Montefiore Nyack Foundation was founded back in 1985 by a group of concerned citizens of the hospital, very special friends of the hospital that wanted to make a difference. There were things that needed to be purchased. There were things that renovations that needed to be done. You know, this is back in the early 80s, and you know, they formalized uh, a special foundation in order to do those things. Things that have been purchased over the years, renovations, such as renovations to the Jacobs Family Maternity Center, has been done under the foundation. Um, We've done numerous things, such as expanding on our imaging suite and the emergency department. That was something, so if you ever had an x-ray, whether in the old or new emergency department, that was purchased by the foundation. The foundation is also governed by a board of directors. So we work together to ensure that the hospital has the best of the best, and that's through fundraising. We connect the dots in terms of what are some of the needs that the immediate needs that the hospital has, what are some of the immediate needs that patients have. And we connect those dots and we communicate that to the public and to our donors to see if there's any interest. And we also make sure that we continue to thank our donors, because we cannot thank you enough. First, I do want to thank all of our donors that are listening today and that will be listening to this. Thank you so much. No donation is too little, and we accept every dollar, every cent with open arms, because it does definitely make an impact. So the foundation has been a part of this community, for a very long time, and we intend on staying here as long as the hospital's here to support the efforts of their patients and the caregivers that provide the amazing care here for the hospital.
Now, let me ask you something. When we're talking about donations, and especially for Montefiore Nyack Hospital, is it only in dollars, or are there like item donations that people
Sure,
can?
that's a great question, Sandra. So yes, in addition to monetary donations, the hospital does accept in-kind donations. So that was a big thing for the hospital during COVID. When COVID-19 crippled our community, the community really helped us in ways that we can't even describe how wonderful it was. So just to put, I have a note here. So just to put into perspective what the community donated during that time, they donated 6,500 individually wrapped meals to nourish staff and caregivers. They donated 11,000 handmade and N95 masks to help stop the spread of COVID within our hospital, 4 walls. 1,600 iPads, tablets, and chargers combined for patients and their families to stay in touch from a distance, because we weren't allowing visitors in the hospital at the time. So that was a huge thing that really, really contributed to some of the healing that the patients needed. They needed to see their families. Also medical supplies such as ventilators, VPAP machines, heated humidifiers, oxygen concentrators, gloves, hand sanitizers, antibacterial wipes, no-touch thermometers, and much, much more. So basically, when the community was suffering, they stood up with us to ensure that we had everything that we need during our suffering. And again, we cannot say thank you to the community enough. I mean, this was an incredible effort, and we could not have done it without all of you watching.
And Tracy, I don't know if I just missed it or you failed to mention food, because I remember we got so much food.
I said food. We
okay, good.
6,500 individually wrapped sandwiches and plates, etc.
Yeah, that was a lot. And let me tell you something. Yeah, it is a lot. And from like the iPads, for example, we got iPads in my department, in the community and education department, that we are still using because we still cannot go out to the community. We still cannot talk face to face with patients that have COVID and have diabetes, for example, and we need to educate all of those patients. And we're using those donated iPads to be able to communicate with our patients and our community. So it's that, I mean, I know the community was amazing and they really helped during COVID.
Yes, indeed.
And Alette is asking, can you identify where the greatest need is at the current moment?
Right now, I would say, Alette, that's a great question. And I wouldn't say it as the greatest need because I feel that there's different needs for different people that are important and imperative. So there's a few different things I'll talk about. So the first thing is our transformation project. We are in knee deep into a capital campaign. Our capital campaign is special and it's funding our transformation project. About $7 million of the multi-million dollar project has come from the community to help us build our emergency department. As everyone, God forbid you have been there, but has made such a difference. The size and everything, the patient care that we're offering, just the size of this emergency department has truly made a difference in the community. It's going to double in size come July when the second phase opens, and that will include a pediatric emergency department as well, helping our littlest patients in the community heal and feel better from being sick. In addition to that, we also have our brand new cardiac cath lab that was opened, which was being funded through the capital campaign. And we are about to break ground on our guest enhancements and patient enhancing the experience of patients, which includes our multi-level parking garage, as well as our renovated welcome center. I just want to share, can I share my screen?
Oh, yes, please.
Okay. I just want to share
Let
this.
me know if you're having trouble, but you shouldn't.
So these are the renderings of how this is going to look. So this will be the front of the hospital. To the left is the parking garage that we're looking to build. This is the bridge that's going to lead over into the current facility here. This is basically the cul-de-sac. And you could see already, aesthetically, there will be enhancements. This is going to be the new lobby that we are going to be working on. So this is the lobby, the new lobby renderings that will look similar. And it's beautiful. It will have this rotunda here to ensure that guest experience can see everybody and attest, and help everyone's needs that are coming in. It's also, we'll have a coffee shop, which is great. And we'll be able, just the look alone will really make a difference here for the hospital. So that's in terms of one of the greatest needs. So I would say the capital campaign is definitely one. The transformation project is definitely one of the biggest. The next thing that we're looking to do is start a patient experience fund. So there's 325,000 residents that live in the county, and more than half have come through our doors on average on an annual basis. So whether that's inpatient, outpatient, through the ED, through our breast center, through our MS, our Madeline Borelli multiple sclerosis center, 180,000 patients have come through our doors, which is a lot. About 80% of the patients are on Medicare and Medicaid, and some of the patient needs, immediate needs, like we've had patients come in that, don't have food, don't have clothing, haven't eaten anything in days, don't have any place to stay, doesn't have transportation to get home after having a baby. So things like that. We're looking to start a patient experience fund here through monthly giving. We feel that that's a favorable platform to reach out to the community, to ask those to donate $5, $10, $25 a month, because those donations certainly add up and can make a difference in the lives of patients and families that don't have anything and that need us during their stay here. So we are working on that. So I would say that's the second emergent need that we will be working on, Alette.
Mhm.
Did I
And
answer your question okay?
let's just thank you. So I guess so. And
Okay.
I love those pictures. You know, I'm feeling here quite excited. I'm like, what an excited time to be working at Montefiore Nyack Hospital,
It
because
really is. I mean, if you think about how much the hospital's grown and, not just, just physically, but also internally, the hospital is the largest employer in the county. So, you know, everyone should feel invested in having this hospital thrive, because it will be very glaring if this place were to ever close. There would be
Mhm.
many, many people affected. So we have to be proactive and vigilant in raising monies to ensure that we will stay open for generations to come.
Mhm. And under the same line of topic, Jill is asking, how do you conduct your fundraising? Would it be calls, or do you have like a targeted list of potential donors that you contact? How do you do your fundraising?
Well, Jill, just to be frank with you, I don't sleep. Okay. So it is, I would say, a 24/7 job. We are kind of doing some, community groundwork, rebuilding and building on certain programs that we already have here. One of those is building onto our Grateful Patient program, which we're super excited about launching probably in the next 6 months or so. The next thing is that we do have a target list. We have separate lists. We have list of volunteers. We have list of donors that give certain amount. We have list of major donors. We have a list of foundations, et cetera, et cetera. And also those that attend our events. So it really depends on what the ask is and what the platform is in which we're fundraising for. So most recently, we launched a Doctor's Day 2021 campaign where we've never done that before. So I said, you know what? We're going to go for it. We're going to ask our grateful patients, our direct mail donors who normally give to our appeals. We send a direct mail piece about twice a year. We're going to ask all these people to support Doctor's Day. So with your donation, along with a heartfelt note in which you're honoring your favorite and special physician that made a difference in your life, we would then share that note, not the donation amount, but we would let the physician know that you made a donation in their honor, and or let the physician's family know, if this person is no longer with us, that they've made a donation in memory of this doctor, along with the special note that the donor has given. And it really was special. I would like to read, if you don't mind, read a letter from one of our patients that wrote a very heartfelt letter to Dr. Matthew Lawnberg, who is an amazing oncologist here through our Highland Medical staff. Dear Dr. Lawnberg, happy Doctor's Day. Thank you for your caring, compassionate ways and for always being there when I needed you. Your calm demeanor was just what was needed to alleviate my anxiety. You took the time to answer questions and return calls. When I received my cancer diagnosis, everyone told me, you have to go to Sloan. For numerous reasons, long drives to the city were not an option for me. I have never regretted my decision to seek treatment locally. The care provided by you and at the infusion center for chemotherapy was exceptional. Thank you for being such a special doctor in my life, and eternally grateful, and signed, the grateful patient, who will remain anonymous. So those are the things that not only it's so helpful for us to know who our grateful patients are and what they're saying about the doctors, but it's also inspiring to share this information with the doctor itself, so they know that these people need you. We need you. You know, oftentimes we go on autopilot, we go onto our days, but, you know, and especially in this life of COVID that we're living, has been like one thing after another. So being able to share these heartfelt notes with the physicians was really special and empowering for all of us. So
now, this was something you did for Doctor's Day, but
yeah.
is this something that you could do throughout the year? Because, you know, now,
Yeah, we
like
will
right
be
now, I feel
doing,
like I want to write a note and donate something.
well,
You
you
just
should.
inspire me. So,
You should, Sandra. We can talk offline about that. Again, no donation is too small.
because it's a beautiful thing to do. Like
It
really, you
really
know,
is.
like show of gratitude. You know, it's beautiful.
It is. It really is. And the doctors just loved it. And, you know, it just proved that we'll do something more extensive next year for Doctor's Day. It is a national holiday, and it usually lands on March 30th of every year. So it was really special this year. But yeah, we do intend on doing other things for different, you know, groups of people here. Of all of our caregivers means so much to us. Nurses Day is coming up. Actually, it's coming up
Next
next
week.
week.
Mhm.
It's Thursday, May 6th through the 12th, and we are going to be sponsoring, the foundation is sponsoring the breakfast for the nurses, as well as giving away a nice sweet treat for the night staff that come in. We thought it was important to acknowledge their efforts. Personally, our board wanted to say thank you in some way, and we said this was the right thing to do, and we're just so honored to do it. We also will be launching a special raffle just for nurses. We will be putting all the names. We've been working collaboratively with HR to put all of their names in a raffle. And daily from May 6th through the 12th, we will be pulling a name and offering them prizes. We have an Apple Watch to give away, Visa gift cards, Starbucks gift cards, Dunkin' Donuts, and a gift card from the Strawberry Place in Nyack. And I'm sure the efforts will go well. And who doesn't love a fun raffle, a free raffle, in fact. So we're super excited to award some of the nurses with these gifts. We wish we can give everybody, but we figured food is priority, and then we have the fun stuff later.
And there are other events that the foundation does, right? It's just due to COVID, you know, 2020 was an odd year, but don't you have like a golf
Sure.
like things like that?
Yeah, so it's interesting because, you know, with COVID, people started doing a lot more outdoor activities, right? To not stay indoors too much, but to be active, and golf was one of them. And we hosted our golf outing, and it was more successful than ever. We had a full round of golf, socially distanced, of course. I believe we had about 144 golfers in the course, and that's a sold out course and an 18-hole golf course at Rockland Country Club. We raised a record amount of over 300,000, and we are hosting our golf outing again this year on July 19th at Rockland Country Club, and we've already got the ball rolling. Haha.
And how did you find out about these events?
Sure. So I just want to talk about you could find out more about our events on our new website, which I would love to share my screen with you. I'm just so excited. We all felt that the foundation has been around for so long and needed its own platform to share ways to give, creative ways to give, and patient stories and other fun facts, impact summaries about the hospital. So this was launched actually yesterday.
What a great timing.
Wow, right?
Really, who knew?
Let me share my screen and share with all of you. So This is our fun website. Our new URL for the foundation is MontefioreNyackFoundation.org. So this is where you can donate, find out more about our events, find out more news about what's happening in the foundation. You can find out more about us. There's a photo gallery, and also there's information about ways to give, which is the traditional ways of giving. So tribute gifts are in honor or in memory. There's also our Tree of Life, which has been around for decades here at the hospital. We also have, our Grateful Patient program, again, which will be launching soon. So that's just a nice soft launch of that. And our monthly giving program, which is called Become a Gem, which stands for Give Every Month. We do have our illustrious President's Circle. These are folks that are presented in this special circle. As per our CEO of Dr. Geller, it's an accumulative giving society of a certain amount in order to be inducted, and you receive special benefits as a result. There's also our Caring for Your Health corporate giving program, and also matching gifts. Matching gifts is an easy way to donate to any organization. If you donate, sometimes your employer will match it. So it's important to speak to your employer about these things. I would reach out to HR to see if there is an opportunity for your employer to match your gift of any amount. We also have creative ways of giving. This really leans on the side of non-cash gifts. So planned giving, stock and real estate, DAFs, donor advised funds, things like that. Life insurance. People are taking out life insurance policies and making Montefiore Nyack Foundation the beneficiary should anything would happen to them. And that is an amazing way of making a difference here at the hospital. And also IRAs, as people get close to retirement and trying to figure out, what their philanthropic landscape looks like. These are the things that you should definitely look into when planning, ahead. But of course, I do advise everyone to speak to their financial advisor or their tax attorney, et cetera, to ensure that these options align with your financial goals.
Mm-hmm. Tracy, talk to us a little bit more about the Tree of Life.
Sure. The Tree of Life has, it's a long-standing tradition. It's a beautiful placard displayed in our lobby, and there's different levels of giving based on what you would want to do. So tribute gifts are a great way to show your support of the Tree of Life. So in honor of someone special in your life, you can make it's a certain donation, and in memory of someone, we then create a placard and it goes right on to the display in the lobby. People have also done these things for those that perhaps, a grateful patient, here most recently has showed their support by making a placard in memory of the family member that passed away here, because they wanted to show their support of the staff that has done a great job of taking care of their family member. So there's lots of special things. Birthday celebrations, anniversaries, things of that nature can certainly be celebrated through the Tree of Life here.
That's beautiful. And I can see here the 125 years of service, that celebration. That was my next question, so I'm happy to see it here.
Yes, so we are super excited to be hosting our 125th anniversary celebration. We are hosting an outdoor, fun, festive, socially distant, mask-wearing event that you don't want to miss. It is on Thursday, September 30th. It's from 6 to 9 p.m. And it is at the Palisades Credit Union, home of the New York Boulders in Pomona. We are honoring 3 amazing honorees. First is our illustrious CEO of Monty Medicine, Dr. Philip Oswa. Dr. Oswa is the CEO of Montefiore and has welcomed the Nyack Hospital family with open arms. Not only is he a resident of Rockland, but also he is an amazing physician and healer. He's a pediatrician, and we're super excited to be honoring him. He will be the first physician in the Montefiore system honored here in Rockland, and we're super excited to host a grand party in his honor. Also, we have our amazing board chair of our hospital board of trustees, Richard. People know him as Dick Kohlhausen. Dick has been here for almost a decade as our leader of the board, ensuring that the hospital stays in great financial standing, ensuring the hospital has the best of the best state-of-the-art equipment, all the things that help this hospital continue to serve the community in which it's accustomed to. So we're super excited to honor Dick that evening. Also, the Village of Nyack. We thought it was appropriate to honor the village because the village was indeed the ones that built this hospital back in 1895. So they were the ones that got together, a group of concerned citizens came together to build this hospital because they felt there was a need for first-rate medical care right in their own backyard. And here we are, 125 years later, and we're really making this a grand celebration. No exceptions, because you only turn 125 once. I do want to give a special shout out to our anniversary committee, who has done an amazing job with raising money so far and getting the word out. But we have 6 months to go, so we intend on really revving things up to ensure that this is the best event in the hospital's history. And I also want to thank our incredible leaders, our event co-chairs, Dr. Mark Geller, who is our CEO, as well as Mark Jacobs, who is our foundation board chair, as well as a hospital board of trustee, and also Paul Adler, who is also our on the foundation board, as well as a hospital board trustee. These gentlemen have really done a yeoman's work in getting the word out and ensuring that we are hosting the best event ever. So we hope you all can join us.
That'll be amazing. That's an event not to miss, and hopefully it doesn't rain that night. Do you have a rain date?
No, if it rains, don't you worry, Sandra, because we will have everything tented. So no excuse. We really see this as like the coming out party because it is outdoors, and we sold a significant amount of tickets so far. We do see this as really a coming out party and to celebrate like a bittersweet moment, to really reflect on what we went through. We went through this tumultuous year, but also to look at the future to see what's in front of us, which is truly amazing. So we're just excited. We will be dry and happy that evening. So don't worry about rain. And it's not going to rain.
Perfect. No, it's not going to rain. Well, what am I saying? No.
No.
It's not going to rain. Yes. And we have another question from Jill. Besides patient experience, that new patient experience project that you're putting on, do you have any other ways to give back to the community?
Sure. So that's a great question, Jill. We do partner with different organizations. Most recently, over the holiday, we partnered with the Nyack Center, which is a community center program. They have a free breakfast program for children. They also have an after-school program for working families to ensure that families can work late while their children have a great snack and can do their homework and have some other programs and activities. We partnered with them to host a toy drive among the employees. Now I have to tell you, the employees here are incredible. Anytime we ask for support for any organization or anybody, everybody stands up and gives something. It's truly amazing to work with this amount of generous colleagues among us. I mean, it truly is amazing. We also have partnerships with the Center for Safety and Change, also Joanio, United Hospice. A lot of local organizations obviously need healthcare, and they turn to us, and we work together to ensure that whoever they're serving can get it.
Mhm.
Did I answer the
And
question okay, Jill?
yeah, and other things is like, for example, people to people, they have their food pantry. I know that there are fundraisers that we do asking staff for food, and we always have food. You know, for example, for Thanksgiving, there was a big donation of turkeys
Yep.
to the food pantry, and you know, it's a lot of stuff that we also do throughout the year. Like, you know, we ask for the hospital, but as a hospital, I know that we're giving back to the community as well in different ways.
Yes, absolutely. And that was around the first time. So I started here in October of last year. And one of the first employee driven activities that kind of came about organically was when the employees were given a turkey from the hospital to say thank you to take home to their families, right? And an apple
Mm-hmm.
pie, I believe.
Mm-hmm.
And there were so many employees that reached out to me to say, hey, can we donate this somewhere? And I called my friend Diane Serator, who's the executive director at People to People, and my friend Kevin Hardy at Meals on Wheels, who's the executive director there, to say, hey, we have employees that want to donate. Let's set something up. And we did. And it was just truly inspiring to see how many people here that give of themselves every day,
Mm-hmm.
right? And here they are wanting to give something that they worked hard for and that senior leadership wanted to give to them, but they wanted to help the most vulnerable still.
Mm-hmm.
So it's truly incredible to see this, and it inspires me to do more every day when I come through the doors.
Yes, and similarly, the year that I started here, we partnered with BOSES to be able to give 12 families actually with children with disabilities a Christmas party that they weren't going to be able to have at home.
Right.
So we collected gifts. We had the cafeteria in the hospital donate food, like a beautiful meal for 12 families. We had um, one of our volunteers dressed up as Santa and give out gifts. It was a beautiful Christmas party. And, you know, it's something that we decided that we were going to keep doing year after year. But last year, because of COVID, you know, and social distancing and all of that, we couldn't do. But that definitely was so beautiful that people are invested on making it a tradition, on helping the community that way.
Yeah.
So beautiful ways, and again, it's about receiving, but you know, there is no receiving without giving. So that's the beautiful part of all of these, and you get a warm feeling in your heart every time you give, and when you
That's
know that your money is invested well and it's making a difference, I think that's important to continue giving, right?
That's very true, Sandra. You know, somebody said it, and it's an anonymous quote, that not everyone can do everything, but
Mhm.
somebody can do something.
Sure.
And if we live by that every day, it's like that little thing, you know, it's paying for the person's tab behind you in Dunkin' Donuts. It's about paying it
Mm-hmm.
forward.
Mm-hmm.
It's I don't know, giving the person the parking spot who's behind you. You got to go give it to the person behind you. You know, it definitely, I believe in karma. It definitely will brighten your world and make things better and make way for even better stuff to come
Mm-hmm.
your way. And
Yeah, yeah. And I think that COVID has helped with that as well. I think that
yes,
COVID has been tough, but it has also left meaningful lessons for our life. So,
For sure.
everything happens for some reason. Okay, and we're getting to the end. Any final thoughts, Tracy? Anything else that you would like to share with us?
Well, I will just want to say this, that, donating should come from the heart. It should be meaningful. It should be impactful. There are definitely ways that can happen here. And somebody said it best recently that their grandmother needed care here, and she said, you know what, I took this place, quote on this place, meaning the hospital, for granted. And it was when she walked through our emergency doors that she realized, in the care that she received for her grandmother, that she realized that we can no longer take Montefiore Nyack Hospital for granted, and that everyone should be invested in some way, shape, or form here. So I encourage anyone that wants to give, that wants to volunteer, that wants to just to be a part, or just wants to meet for coffee, to chat, to see how they can fit in here. I encourage you to reach out. Our information is on the website, or you could call me directly. My phone number is 845-348-2771. And my email again is on the website at montefiorenyackfoundation.org. So please join us. That's my final thought.
845-348. I'm writing it down in the chat box.
2771. And again, you can go on the website, montefiorenyackfoundation.org, to find my contact information.
Yeah, that is beautiful. Yeah, foundation.org. Let me see. Of course, I have spelling issues. Foundation. Okay, well, this has been indeed very touching and inspiring. So hopefully, more people get to learn about what the foundation is doing. Your wonderful work, Tracy. As you said, you don't sleep. I know that your brain is always thinking, okay, how are we gonna make this hospital grow? And we are growing, which is the beautiful thing, that we can see how, the community investments are being put to work, and everything is beautified, and we have more quality services and all of that. So maybe we go back to how we started. Maybe one day we will be able to say we're the best hospital in the world. Who knows?
Well, I say that, but it is true that we are Rockland County's hospital. When you think about our footprint, and you think about where we're located and the amount of people we've served in the community, we are Rockland County's hospital.
Beautiful. And we have the support of Montefiore and a whole Monte system.
Yes.
So, it's nothing to lose there.
Sure. For sure.
Okay. Sure.
So much, everyone. I actually have to go and accept another donation. Yay.
Good for you.
It's been a pleasure. Thank you, Sandra. Thank you, everyone, for watching. And I hope that we can talk soon. And for all of those that have donated, I look forward to a time where I can come and thank you in person.
Beautiful. Thank you so much, Tracy, for talking about all these beautiful things. Truly inspiring.
My pleasure. Thank you so much.
Okay. Thank you, everyone. We'll meet you next week. We're going to be talking about nutrition, how to turn vegetables from yak to yum. So we're going to have two dietitians helping, and we're going to have a cooking demo and giving tips on how to cook vegetables to make them delicious. That's all for today. We will see you next week. Thank you for your attendance. Bye-bye.